Pulmonary arterial hypertension is a rare chronic progressive disease associated with the decreased production of the pulmonary vasodilator prostaglandin, or PGI2. PGI2 is synthesized in the endothelium. Its main target is the IP receptor, which is expressed in vesicular smooth muscle cell layer of the pulmonary tissue. The decreased production of PGI2 has many cardiovascular and pulmonary effects. This disorder is characterized by high blood pressure in the pulmonary arteries on the right side of the heart. These arteries supply blood to the lungs. Pulmonary arterial hypertension occurs when the pulmonary arteries thicken or become rigid, making blood flow more difficult. The heart has to work harder to compensate for this. However, the arteries aren't able to carry adequate blood to the lungs, resulting in hypertrophy, right ventricular overload, and ultimately right heart failure and premature death. The treatment options currently available for hypertension only aim to improve the patient's quality of life by lessening the symptoms of the disease and slowing its progression. Ultimately, pulmonary arterial hypertension is a severe disease with poor prognosis despite available treatment options.
Uptravi is an oral tablet with film coating, and the active ingredient is Selexipag. It is long-acting, highly selective, non-prostanoid prostacyclin receptor agonist that delays the progression of pulmonary arterial hypertension and reduces the risk of hospitalization. Currently, there has been no clinical observation effects between age, gender, race, and body. Initially, when tablets is absorbed, interaction with warfarin can occur, but only has drug interaction with CYP2C8 inhibitors. Of food, Selexipag maximum plasma concentration can be delayed. Selexipag is rapidly absorbed, then is hydrolyzed by hepatic carboxylsterase 1 to form the active metabolite ACT-333-679. This converts occurs in the liver. Both compounds have good permeability across cell membrane. ACT-333-679 induces vasodilation and is not weakened by antagonism of the prostaglandin E3 receptor. The drug also undergoes oxidative metabolism via CYP3A4 and CYP2C8 to form hydroxylated and dealkylated metabolites. With ACT-333-679 undergoing gluconidation via UGT1A3 and UGT2B7, and its metabolite is predominantly eliminated in the feces. Traditionally, drugs aim to target three major signal pathways: the prostacyclin, endothelium, and nitric oxide. When patients first start taking Selexipag, they begin on 200 microgram dose, with a weekly interval increase of 200 microgram, until they reach their therapeutic threshold or maximum dose, which is 1600 microgram. Selexipag may be taken with or without food.
Selexipag is a drug that acts as a vasodilator, an antiproliferative, and an antiplatelet aggregator. Selexipag promotes the relaxation of pulmonary arteries and thus causes them to become dilated by increasing the amount of PGI2 produced by the endothelium. PGI2 then binds to the IP receptors, which are G-coupled receptors located on the surface of vascular smooth muscle cells, platelets, and other cells, which then cause the dilation of the vessels. Selexipag's metabolite ACT-333-679 assists in vasodilation by causing a sustained increase in intracellular cyclic adenosine monophosphate. Selexipag's actions as an antiproliferative agent result in the prevention of cell remodeling, thus reducing endothelial cell dysfunction. Selexipag does this by binding to the platelet-derived growth factor receptors, thus preventing the expression of phosphorylation in the pulmonary arteries, which is the cause of the remodeling. PGI2 also has antiproliferative actions. Selexipag's actions as an antiplatelet aggregator occur through ACT-333-679, promoting fibrinolysis, which is the enzymatic breakdown of blood clots. Through Selexipag's and ACT-333-679's actions, the drug is able to delay the progression of pulmonary arterial hypertension and reduces the need to initiate parenteral prostanoid therapy the use of long-term oxygen therapy, and the need for a lung transplant or balloon arterial septostomy.